Hey guys, I just want to do a quick review of the structures from last time because I kept trying to point them out and I didn't have my mouse functioning, so I want to make sure we've covered those. You understand the functions. We're going to do that rapid, and then we're going to get into diseases and disorders from there. So real quick, ovaries, that's the female gonad. It sits here. All of this is in the pelvic cavity. So this is the ovary, and it produces the egg cell, and it also produces progesterone and estrogen. And here we have the uterine tube. The uterine tube transports the egg from the ovary to the uterus. The uterus is job. I'm going to go to the next slide for that so you can see it better, because I kept trying to point this out. I kept saying, here are the sections of the uterus, and you couldn't see what I was doing. Top part is the fundus. This is the body, and then at the bottom of the uterus is the cervix. Okay, so they kind of split it up top to bottom and then in to out. So here's the endometrial layer. That's going to be important in a minute. This is the muscle layer, the myometrium. And then perimetrium is the outside or around. That peri means around. Okay. So that's female anatomy. Vagina, again, is the copulatory organ and also serves as birth canal unless mom has a C-section. So last thing I think on females that I want to point out, because we've talked about similarities between males and females. One large difference, I guess, that we could point out is that remember, urinary system, here's the bladder, and this is the urethra. So the urethra is not a part of the reproductive system at all in females, whereas the urethra in the males is a transport for urine and sperm. So just a difference there. Okay, on the male anatomy, we kind of went through the pathway of the sperm, and that's kind of how I covered this, and I left out a really important part, which is the scrotum. So the scrotum is actually the tissue surrounding the testicle, and it consists mainly of like skin and a little bit of smooth muscle. And the reason why you would need any kind of smooth muscle or muscle there at all is because sperm have to be at a set temperature, and it's like a couple of degrees difference from body temperature. So the scrotum kind of protects as much as it can. It's a very sensitive organ, but the scrotum with this minimal smooth muscle, the main function is to basically control for temperature. So if it's hot outside, then the smooth muscle in the scrotum will relax, so the testicle will be farther away from the body. If it's cold outside, then the smooth muscle will contract and bring the testicle closer to the body. The whole point is keeping those sperm cells healthy, because they die if they're in the wrong temperature. So testes produce sperm. Those are here. Scrotum is around it. The epididymis is the sperm college. The job is for sperm to mature here. And then the vas deferens is the tube that connects the epididymis with the urethra. Okay, so it's just a transport tube for sperm. And then we come across some glands. The only one that you'll need to remember is the prostate, but remember it passes by the seminal vesicle. It passes through the prostate, and then the bulbourethral, you'll see it in the next one, is kind of at the base of the penis. The penis is the copulatory organ for the males. Okay, so here is that last gland, the bulbourethral gland. I'm trying to think if I left anything out. I think that's pretty much it. Okay, on to diseases and disorders. So the first one is endometriosis. So we have that endometrial layer inside the uterus, and you can see that information there. I'll let you write what you need to write. But the endometrial layer is this inner lining of the uterus, and we want that tissue to grow there. What we don't want is for that tissue to grow anywhere else. So endometriosis is when you have endometrial tissue growing outside the uterus. So in this picture, we have it kind of on the uterine tube, up here on the fundus part of the uterus, and then we've got it on the uterine tube over and the ovaries. So they're not really sure why endometriosis happens, but there are some possible explanations. The main one being that it could be from backflow from the menstrual cycle when we're trying to slough off that layer. They think maybe sometimes backflow will get into the uterine tubes, or maybe some flow will be in kind of the just kind of the outside of the uterus here. and start to grow. So they kind of think that's what's happened. But here are the signs, symptoms. That's what the SS means right here. In this particular picture, you can see that it's growing into the myometrium and the parametrium and even onto the bladder a little bit. We just want that in the endometrium. We just want it inside the cervix. So they'll try and target it with medication, and then surgery could be an option. So surgery is a rough one with this one, because there are reproductive years that they want to be real delicate with and want to make sure that you're making that decision with a lot of weight, because that's a big one. Okay, another female reproductive issue is breast cancer. 1 in 8 women suffer from this one. So this is one that kind of matches prostate cancer in males in terms of prevalence in our community. But in this one, at one point, they were kind of stopping telling women to do breast self-exams because they were getting a lot of false positives. But there are a lot in the medical community going, why would we care about getting false positives if we're getting it early? That's the big thing. That's what we want. And so they've kind of come back around to say, check your breasts, and you should understand your body. So once a month in the shower. This is typically how a doctor will have you position for this self-exam, but you'll just basically in a circular motion, you need to actually, starting in the armpit, go around the whole breast. And if that tissue changes from month to month, and especially if you find bumps and lumps, it's a good time to call the doctor and say, hey, I'm a little bit nervous about this. Okay, so hopefully you got the information you needed. I'll ask the questions you need to find it. Another female reproductive issue is cervical cancer. So this one is certainly not as prevalent as breast cancer, but still a female reproductive problem that happens. So this is caused by the human papilloma virus, which they can test for with what's called a pap smear, and we'll talk about that in a second. But there are other causes. Smoking, we don't know exactly why, but it just smoking tends to affect every organ system, and reproductive doesn't escape what smoking can do to you. So if you leave this class with nothing else, please never smoke in your life. Having multiple sex partners, or women who have sex partners who have multiple sex partners, that can be a problem. So regular pap smears is key for this. They have started making the HPV vaccine, so that should help with the prevalence of it. But they're going to get a closer inspection of the cervix particularly. So they use what's called a speculum to basically make room for the swab. But the swab is going to go in and actually grab some cells from the cervix, and then they'll analyze those cells to make sure that they're healthy cells and not human papillomavirus. Okay, so symptoms of cervical cancer include these. And treatment for cancers, this is usually the 3, and it depends on the cancer, kind of what order. But they're going to poison it, so they want to do chemotherapy, they want to do radiation, and then they want to, or depending again on the cancer, they might do surgery first. But surgery is another option. Take those cells out. Okay, on to the males. If you've ever watched cable news channels, it seems like that's where you run into these commercials a lot. You kind of get the demographic from those commercials, but there were a lot of commercials where there were older guys that were like out fishing in a rowboat or something, but they're like, oh shoot, I have to go to the bathroom, and have to go to the bathroom. So if you see commercials, I can't remember what the drug is, but it's essentially for prostate problems. And you'll see older guys need to go to the bathroom a lot. It's because, remember that the urethra has to pass through the prostate gland. So here's the bladder, and here's the urethra. So this is a healthy, normal prostate. This is an enlarged prostate. And the symptoms that they will experience is they'll feel an urgency to urinate. They'll feel like they have to go pee a lot, even though they're not getting any urine out. And a lot of times they're not getting, so we could have a full bladder. Sometimes it just feels full because we've kind of closed the space here. But they're also not getting a good flow of urine. And so they'll need to do medications and some surgery. This is kind of similar to the endometriosis problem that girls have. Okay, this is the young man's cancer. This one doesn't happen nearly as often as the next cancer, but this is one that is, they call it kind of the young man's cancer. So this is one Lance Armstrong had. So in his case, he actually had to have a testicle removed. So just quick fun fact about that, because a lot of times people say like, wait, can he still have kids? What's going to happen? If a male loses a testicle prior to puberty, the body will adapt and actually will that one testicle will grow larger than a normal testicle, and it will produce 85 to 95% as much sperm. But if someone loses it after puberty, then you only produce like half as much sperm. So kind of a fun fact. But this is the one where boys need to be familiar with their bodies. It's just a good idea to understand. Like if you have moles on your body, you can't always see on your back. So when we're talking about skin, you want to be able to check for things that are abnormal. Same thing with your reproductive organs. So girls need to be doing breast self-exams. Boys need to be doing testicular self-exams. If you notice anything from this bullet point, then that's something you need to actually go see a doctor for. Okay, with STIs next. I'm just going to read off some generic symptoms that can happen. But what you need to understand with STIs is sometimes people don't even know they have it. So it's really important that you weigh your decisions. So I'm going to liken this to another system. So in America, I've said this so many times this year, we counted up 1, 2, 3 dead. 1 in 4 people are dying from heart disease. And there really are only a couple, maybe 3 things, 3 risk factors. Like, well, there's nothing you can do about that. For example, you cannot control who your biological parents are, period. There's nothing you can do about that. So that's something, okay, can't control that. Got it. Okay, we can't control what gender we are. We can't control how old we are. You're aging or you're dead. So outside of that, can you eat healthy? Yeah. Can you exercise? Can you sleep? All these things. It's the same for every system. You have to basically weigh like what kind of health do you want to have. And there's evidence and all kinds of books on how to do it right. So if you want to actually live long and happy, you need to pay attention to what you're doing to your body. So STI, so it could be symptomless. So first of all, you really should be able to trust your partner. But here are some symptoms that are common symptoms kind of over the course of different, this is from Mayo Clinic again, because I was just on Mayo Clinic all day today. Okay, sores, bumps on the genitals, painful burning urination, discharge from the penis, unusual discharge from the vagina, unusual vaginal bleeding, pain during sex, sore, swollen lymph nodes. So, sounds like a good, fun time. But really, the best way to prevent is abstinence. The other methods you need to talk to your parents about. We will not talk about it in this class. So I'm gonna share with you in a different format some common STIs, just so you've kind of seen and heard about each of these. So we'll go to that. Okay, so I'm coming to you live from my home gym. So try to just show you my STIs and kind of just give you an overview of bacterial versus viral. Bacterial, typically we're going to be antibiotic, and if you catch it early, you're good. But if you don't catch it early, it actually can wreak havoc, especially in the female anatomy. So pay attention to your bodies, you guys, and make sure you're making some really smart choices. Okay, this is chlamydia. This This was a biggie in Davis County a little while ago. I don't know if it's still number one, but it's been number one. Chlamydia is bacterial. I think painful urination discharges chlamydia, STI, bacterial. Syphilis. They make these in the form that they kind of see under the microscope, and then they just give them color and eyes, make it a little animal. This is syphilis, also bacterial. Treated with antibiotics. Hopefully catch early because it will wreak havoc. In some cases, if it's left in the female reproductive tract long enough, it can get to the point where girls cannot reproduce. So pay attention to your bodies, make smart choices. This is the clap. If I were to like rank which one's the ugliest, it's this one. I think it's so ugly. Gonorrhea. That's gonorrhea. Bacterial, treated with antibiotics. This one's herpes. Herpes is a virus. So there'll be flare-ups and there'll be latent periods, but this one gets on board for life. So another STI. Main take-home message though with any system really is you are in control. You're in control of your destiny, of your future. When you weigh every decision, should I eat right? Should I exercise? Should this be my partner? Whatever your choices are, you need to look at your values, your goals. How do you see yourself in the future? Take that into account before you make big choices. There's my soapbox.